Here we go. Well, hello and welcome back. I hope everyone's feeling recharged. The afternoon will continue to deliver exciting content, and all the content, as I mentioned this morning, from today will be available to view on demand in 24 to 48 hours. So don't worry if you've missed something earlier, you can always catch up. As the demand for more digital tools to be used in healthcare increases, electronic monitoring is in high demand. 96% of young doctors have said that they would want to use smartphones or smart technologies to access medical records whilst treating patients. Using new technologies can increase staff performance in areas such as administrations, operations, and patient care. Providing workers with a well-structured digital programme will ensure that patients are able to receive a high standard of healthcare. So let's talk about how the use of technology will enhance workforces and provide higher standards of healthcare. So on this panel, I'm delighted to say we're going to be joined in a moment by Kevin Percival, Chief Nursing Information Officer for Frimley Health NHS Foundation, Delphine Fituri, Head of Informatics at Bradford District Bradford District Care NHS Foundation Trust, and a familiar face, James Freed, Chief Digital Information Officer at Health Education England. And of course, don't forget, if you'd like to put your question to our panel, then you just use the live Q&A function that you'll find at the bottom of the screen. And once we get the conversation going, then I can put some of your questions to our panel. So hello to James, hello to Delphine. I think we've got Kevin will join us shortly. I think he's having trouble getting onto the platform, but hopefully he'll magically pop up shortly. Delphine, if we can start with you. When defining the digital vision for the NHS, how do you describe it to the workforce and indeed then engage with them?
First of all, good afternoon. So I think it's really important to be able to engage with everyone within the workforce. Digital touch and technology touch everybody within an organization. And therefore, we should not limit to a set of senior leaders within an organization, but being able to do that with everyone. Crowdsourcing is a very good platform in order to ensure everyone has the ability to ask questions, to input, or to be able to vote as well as some ideas being put forward. This is a kind of digital platform, can be added with some face-to-face meeting and other things that enable everyone to be part of that. That can be anonymous as well, crowdsourcing, so that enable people not to really have their name at the forefront, but still being able to input their key ideas, their key highlights, and really what matter to them as well. What are their issues and needs a solution for that.
That is important, Delphine, isn't it? That everybody feels part of it and on this journey together.
Yes, it's important that everybody has a voice. And when we talked about technology, everyone is really affected with technology at home, in their workplace, being able to, for them to kind of be able to express as well and to improve the way they're working using technology. And as you said at the introduction, there are many people who want to kind of use smartphones, smart apps. So how do we make this more accessible for the right people to be able to do their frontline activities of their kind of back office activities better?
James, before I come to you, do you want to follow up at anything that Delphine's just said there? Oh, just need your sound, James. Hang on. Hold on a second.
That's okay.
Oh, there we go. There, we've got you now.
Yeah, embarrassing, isn't it, when a CDIO doesn't click his demute button?
Don't worry, I was going to blame the system, but you put your hand up now.
I think it's important to claim one's failures.
It is. Do carry on.
I mean, there's a lot to say on this, but I'd like to just pick it up through other answers, if that's okay, Helen.
Yeah, go on. So, did you want to just carry on, or?
No, go ahead.
So you're the SRO of a programme responsible for delivering digital readiness to 3 million staff in health and care in England. I kind of like stating that fact, James, because it always kind of blows me away that you've got such a huge, responsibility there on your shoulders. So I just wondered how you see the NHS digital vision and the benefits it's bringing, and also has the potential to bring, not just to staff, but also, of course, to patients?
Yeah, so I think it's important to look at this in the context of our lived experience in the rest of the world. So digital technologies are advancing tremendously fast, exponentially fast. We get a doubling of processing power about once every 2 years. Across all industries and every aspects of our lives. That means that the opportunity for change is increasing faster than it ever has done before. Now, what we see in other industries, and we're starting to see it in health and care as well, is that there's just no one person who's able to fully process that opportunity in their head. You know, previously, 10 years ago, or, well, I mean, yeah, 10 years ago, 5 years ago even, you might have someone in my position whose main job was to try and fit it all in their head and then come up with this wonderful overarching strategy for their organization, or in our context, maybe the whole of the NHS. And of course, we do sort of have those overarching strategies, but increasingly, and this is where my role, I think, comes in, if you accept the premise that there is more opportunity than any one person or any collection of 10 or 20 or 50 or 100 or 1,000 individuals can hold in their head at any one time, which is true, then we're talking much more about how you equip the entire workforce to extract value from digital and apply it to solve the problems that they see for themselves, their peers, and their service users, in our case, our patients, on a day-to-day basis. And that requires much more around digital education, governance, and thinking about how you get the right balance between creating organizations and environments that are able to innovate at pace, but also do so safely. So health and care is still the most dangerous industry in the world. And if you make the wrong mistake, people can die. So you need to, it's not as if we want to create a world with no governance, but getting that balance right is supremely important.
That sounds to me really difficult because, of course, when you're trying to create a technology enhanced workforce, so many people in that workforce are already super busy, aren't they? Keeping people well and healthy.
Yeah.
So I suppose what are the secrets? How do you manage to create that technology enhanced workforce whilst at the same time everybody's still safely doing their jobs? I mean, it sounds to me like there's a massive challenge, and I'm sure perhaps all the answers aren't there yet. But how are you trying to achieve that, James?
Yeah, so that's absolutely true. I think the first issue is to try and get people on the same page. So technology enhanced workforce, despite the name of our program. So our program is around digital readiness education. That's not the thing we're selling, right? All digital is a set of tools to enable you to do your job better. That's all it is. And it's a subset of all the tools out there. I mean, it's an increasingly big set of tools. And one of the reasons why we do talk about digital is that it's becoming more and more part of how we get our job done, whether you're a nurse, an AHP, a doctor, or a non-clinician delivering health and social care services. So the trick, I think, the number one starting point is to recognize that the end goal is not about trying to use these tools better. It's about trying to deliver our outcomes better and helping equip people to think about how they can deliver those outcomes, whether it be saving patients' lives or making an experience better or helping staff not feel burned out. You know, we've got a big issue around staff burnout at the moment. So all of those are perfectly decent outcomes. They're part of the quadruple outcomes that NHS England is aiming for. And I'm not sure it's really helping us to talk about the tools. It's a bit like, you know, if you ever had your house done and you get a builder in, if you have a builder who spends ages talking about their hammers rather than talking around the look of your new kitchen or new bathroom, then you're going to start raising an eyebrow. And similarly, I don't want to talk to a nursing workforce of 350,000 and say, be digitally literate or digitally enabled. I want to say, do you not want to be able to spot those pressure sores quicker? Do you not want to make sure that when your patients deteriorate, you're able to stop it before those patients deteriorate beyond the point of return? You know, these are the things that matter to the people who work in our workforce, and digital can help, but it's a means to an end, not an end in itself.
Delphine, do you agree there that the language of the narrative is really important when you're trying to create a technology enhanced workforce?
I think James is spot on in his approach in terms of digital is not an end product by itself. This is the outcome that's really make the difference. And as well, I'd like to kind of come back onto one of the points. Many points were raised as part of that discussion, James. But one of them is probably around the transformational agenda, which is a kind of high-level organization-wide or NHS England-wide that needs to be achieved. And then the incremental changes, the small changes, the quality improvement that everybody within the NHS has the power to control, to change, to make improvement. And those two needs to kind of fit together. We need to have those small incremental changes that support the wider, a bigger agenda to make perfect sense in terms of our patients and how is the impact on our patients and how our workforce kind of cope with the demand as well better in making those small changes, in terms of as well, if we look at clinical systems, if an organization has 10 different clinical systems, that's difficult to manage. One of the big change could be we remove one system and just deal with 9 different clinical systems, which will remove a lot of the load from a clinical perspective and from an administration perspective as well. But yeah, plenty of very good points, James, in your comments here.
I'm just having a little flick through. We've got the Q&A area lighting up already, so stick with me because I'm reading these for the first time. But Dennis says any NHS or healthcare professional would agree that they are change fatigued. Major plans keep being rolled out, and rightfully, as James said, people do not want to hear about tools. How, though, do you approach the workforce to adopt ever-increasing tools and technologies which would make their jobs better and save patients' lives? James, do you want to pick up there on Dennis' thoughts?
Thank you. So he's right. There is change fatigue. However, there are two things that can both be true. They sound conflicting, but they can both be true. So the first is change is going to continue and it's going to get faster. And the second is you can have more say in that change. So we tend to, there's a bit of a culture in the NHS that someone, usually very clever and usually with an opportunity, a privilege of being able to spend a lot of time looking about. And often those people sit in the centre, but not exclusively, will spot an innovation and say, right, there's a benefit there. Everyone's got to do it. And then we think, because there are clear benefits. And then you think, okay, well, how do we do that at pace? And I have to say, the centre has got a little bit of a limited repertoire of levers that it tends to draw upon. And that limited repertoire tends to be quite top down, quite heavy, and usually involves either do this and you can get some money, or if you don't do it, you're going to lose some money. It tends to be quite sticky, if I can use that stick carrot analogy.
Yeah.
And it's led to a culture of mistrust between the front line and the centre. Now, what we see in industry is, whether you go to the Googles or the Amazons or the Spotifys of this world, or actually central government, the central government have got a really good language around this, is the creation of empowered multidisciplinary teams that are empowered to look at the services that they offer. And I'm talking relatively small teams here. So a typical hospital might have 300 of these things in the future. And look at what the outcomes of that service are for the users of that service. So something really practical and grounded, empowered and supported with the right skills within the team to do that horizon scanning, to spot those sorts of innovative ideas and to adopt them, because they are absolutely laser focused on improving outcomes for their patients, for their users. If we can get to that sort of a world, then it won't be about change being forced on people. And really, it's not change fatigue that we've got, it's lack of control fatigue. It's like, oh my God, everyone's trying to tell me to do all of these things, and sometimes they conflict and you use different language and there's different philosophy behind it. And how do I deal with that? I've got a day job. I'm being scheduled onto hours 40% over what I'm contracted. Please just give me a chance here. So it's it's all of those pressures that people are feeling. And I think that for those of us in the centre, I think there's a lot about how we behave in the centre around providing the infrastructure that enables people to very easily tap into that knowledge and that expertise without forcing a pace that's not relevant to them, that is not focused on delivering outcomes. And sometimes we also set targets that are about the means and not the end. It's like adopt this particular bit of technology because it'll make your world better. And actually it should be, well, what's it going to be that's going to help make the biggest difference to the outcomes for your patient? So
and it's got to be consistent, hasn't it, across the board? Otherwise that just gets confusing, doesn't it? It's important. I think there's one voice. Jane, hang on. Oh, actually, Jane just says something nice here. There's the question flip. Jane says, I think this is one of the most informed, practical and sensible sessions I've seen in so long. I hope more people get to see it. Really enjoying the injection of humour and self-reflection, James, which is really nice. Nazneen says, Delphine, what's the plan to train existing staff, like, for example, community nurses, to digitise, and any tips? Is that something that's going on in your area, in the Bradford district?
Yes, yeah, definitely. I mean, training is one of the key elements within our workforce. So our workforce is composed by inpatient activities, but also community nurses, schools nurses, working from different settings as well. So it's very important that people get the right kit, which is one element of it, but how to use that equipment as well. And I think one of the things that we are looking at in particular is to do an assessment of our workforce when they join us, so we know exactly where they're coming from, which level they have, what are the level of expectation as well when they're joining an organization, to then provide them with a tailored program of training to be offered to them. So we have the usual clinical systems training that everyone should go into, even that this is tailored based on the role of the individual. So you don't go through a full day of training on things that's not relevant to you, but really on the module associated to what you will be using on a day-to-day basis. But also the other tools that are being used by the organization. So it's not just around the clinical system, but this is the use of video conferencing. This is the use of other application within the organization. And sometimes there is an idea that people know how to use those tools, to know how to use MS Teams, for instance. Well, actually, those are assumptions that are made by people. Some people may have an awareness of it. Some others may be expert in the use of it. But I think some users may not be confident, and it's gathering that level of confidence as well. So I think having that discussion at the start when somebody is joining in, but also for people who have been in the organization for a long time, they don't have that kind of induction period of engaging with the organization as you would do if you are inducted. So it's to kind of recreate that environment for people to kind of say, well, stop there, I need some training here because that tool, I don't really know how to use it. And it's to be able for people to self-serve as well through different means of learning, through videos or through face-to-face training or through video training. So having a full range of different elements for training staff. As well, when we kind of release equipment to staff, so people in the community will have a laptop, will have a smartphone, we probably assume that we know how to use that. But that's, again, just an assumption. So spending the time with people on an individual basis to kind of find out what do you know? Do you know how to tether with a phone, for instance? And is to gather that type of intelligence, that discussion, to be able to provide people with the right tools so that the technology will not stop them doing their job, but will help them to do their job better.
James, Delphine touched on education there, and of course, the role of education in all of this, I would imagine, is absolutely key. I'm just wondering what impact you can have from national education initiatives.
So the research that we've done indicates that There are certain, well, firstly, that digital skills is not just about the hammers. It's not just about being able to use tools. There's also certain mindsets and philosophies around the digital world, the modern day world, really, which you could class as digital skills. So, for instance, do you know how to access and find high quality evidence? Can you curate your own access to data? You know, basic data skills. But also things like about how you are as a person, how you present yourself, or how you make sure you're safe using technology, which is a skill set that's not exclusively tied to any one particular tool set. That said, our evidence demonstrated that in the context of an organization, a workplace, that there are certain sets of skills that we can measure ubiquitously and we can support ubiquitously. And there are certain sets that we can't. Now, the sets of skills that we find it quite hard to train in from a central perspective are the hammer-based stuff. It's the how do I use Cerner Millennium in this particular trust? And that's because even if you've got the same product from the same vendor, it's configured differently. And quite frankly, different organizations allow different workarounds. You know, there are fudges in how these things are configured and used. So it doesn't make sense for us to commission training around using hammers. It does make sense for us to try and develop general training to support the digital ways of thinking. So for instance, why it's important to engage users and the sorts of techniques you might use to design your clinical services around the users of those services, what we call user-centered design. Or how you might manage a set of digital products that underpin those services. These are sorts of skills that we can and do develop education for and deliver them. For the underlying what we might call digital literacy agenda, the 3 million, the big number that you mentioned before, Helen. So we have developed something called the Digital Skills Self-Assessment Tool, which is 32 basic questions. It's entirely self-assessed. So for those 32 questions, we developed that capability framework in collaboration with an organization called JISC. So they're educationalists. They work in the education sector in the UK and is underpinned by a significant amount of evidence. And those 32 questions are asked twice. Once, where do you think your job requires you to be on this particular capability? And the second question is, where do you think you are? And then there's some clever, what I like to call jiggery pokery in the background. That's a technical term.
I like it when you use technical terms, James. I understand.
That's me with science, Helen.
Where I'm from in Grimsby, there's a lot of jiggery pokery going on.
Fair enough. Well, in this case, there is some clever jiggery pokery, and it maps out where the biggest gaps are, and then signposts you towards bite-sized learning to address those learning gaps. We're in what's called private beta at the moment, which means not everyone can get access to it, but it will be shortly in the next 6 months or so available to every single health and social care organization and many third sector organizations as well. So watch this space.
Wow. Delphine, is that something you've had access to yet, the digital skills self-assessment tool and those 32 questions, or are you still watching this space?
I'm waiting for it to be released.
I bet you can see how
there will be
useful
people
already.
waiting for
I bet
that.
you can see how useful it would be already, though, can you? Because that seems to make perfect sense to work out where people need to be and where they feel that they are, to very clearly identify how much they need to be brought up to a certain standard in what particular area. So I would imagine that'd be really useful, will it, Delphine, when it comes?
Definitely.
Now, Nazneen says, can we repeat the name of that tool, please, James? Did I get that right? Digital Skills Self-Assessment Tool. I did.
Perfect.
Good.
Perfect.
And Latifat says, I'm looking forward to this being rolled out in my area, maternity. Currently, women carry handheld notes and sometimes it's forgotten at home. We'd benefit greatly with digital notes throughout the pregnancy. My only concern is that most of the care will still have to be face-to-face due to the nature and risk that's associated with the specialty. Thank you for those thoughts. And Andrea says, is augmented reality something that's been considered as technology to use in healthcare? Imagine a nurse wearing glasses that prompts them with information about the patients where a skin lesion could be photographed and compared with a database of diseases. Are we at that kind of point yet, James? Have we got that far with augmented reality?
Yeah. There's an apocryphal quote by a guy called William Gibson, who wrote Neuromancer, that was the future is here already. It's just not evenly distributed. So augmented reality is being used for those sorts of functions right now. It's just it's not in a state of maturity that means that everyone can use it for every single function. There's a conference called ComFed that many of you'll be aware of, that happened about 4 weeks ago, I think. And our technology enhanced learning team was demonstrating some of the augmented reality technologies and virtual reality technologies that we're using now for specifically for education use cases. But augmented reality, I mean, you could imagine, can't you, where you've conducting surgery, for instance, and having overlaid on top of it, right, here's the artery, avoid, here's the lesion, stitch, that sort of information, maybe with patient details flashing up in terms of their blood pressure, or you could see how that would be tremendously useful regardless of what clinical profession you're part of.
Wow, it makes the mind boggle, actually, doesn't it? What might be possible. Just on not on augmented reality, but I was at the headquarters of the London Ambulance Service a while ago, and they handle nearly 7,999 calls a day in the capital. And they're using something new, as I say, not augmented reality, but it just reminded me of it, where if you call in, if I fell off my bike and you called 999, they can send you a link on your phone, which suddenly allows them to see my injury and to assess whether I need the air ambulance or whether I've broken bones or whatever. So it's great to see that kind of thing happening and the difference it can kind of make. Delphine, a question I actually had for Kevin, but Kevin doesn't seem to be on our platform yet, sadly. I just wondered about the impact for citizens and society of having a technology-enabled workforce, because of course people and patients are at the heart of everything that you guys do. So where do you see the real benefits for patients and citizens?
Well, I think there are two aspects to that question. First, in order to do their work properly, our workforce needs to have the digital skills that they need, because digital and technology are around us. We can't avoid that. But as well, because of COVID and because of the fact that a number of the activity may take place remotely or virtually, enabling our kind of citizens, our patients, our service users to access the technology as well, help them to empower themselves with their health, and therefore would know when to take contact with our services. So if we look at mental health services, for instance, we need to be able to respond as and when there is a crisis, for instance, but also we need to support mental health service user to identify when they are into a crisis, to be able to contact us when they are in that stage. And sometimes, unfortunately, too late, but if we can get them to have the kind of right reaction, and then things are being automated into people's head, rather than kind of think, oh, I need to go into a website to check what is the number, to call that number. So all of this should be kind of very accessible for people. Our website as well needs to be easy to navigate, so people can access the information quickly, and having that user interface and the user focused way of building interfaces as well is key to get the right information at the right time to the right people.
Also, Delphine, I mean, tech is constantly changing. And in my world, I've seen in some sectors being paralyzed with fear to actually get going because they're so worried about investing, whether it be, for example, in electric vehicle charging, because, are we going to have hydrogen fueled cars soon? So how can the NHS best keep up with an ever changing technology market and ensure that investments are made in the right place and that you're taking advantage of everything new and fantastic as it evolves?
And I think that the role of every digital leaders is to kind of look at what is coming out there. We talked about augmented reality. Is it something worth being looked at based on the patient outcome as well? In some cases, yes, the risk is massive. We're talking about a lot of money associated to rolling out big project. But looking at a small pilot, looking at the benefits of it, seeing if it can be rolled out, are those little steps that needs to be considered as well. I think engagement with suppliers as well, the big suppliers that everybody knows, but also the local, more niche type of supplier as well can be the one that really develop something that's actually needed for the people that you are looking after, maybe because they have some special specificities as well, or you provide a very specialized services, and therefore what you have out there will not be given by a big supplier, but will need to be tailored to your needs as well. But looking at investing in digital, this is the future. Organizations shouldn't be scared in investing in digital, because we'll not look back. There's a lot happening around automation. We went through automation within the industry, vehicle industry 30 years ago. And we have not seen that in the healthcare sector, for instance. So automation will be coming and is there. So it's to kind of make sure we take opportunities there and roll them out.
James, it's almost time for our break. So final word to you, if you don't mind. I'm kind of asking you to get your crystal ball out. Where do you see the biggest changes coming?
Attitude. It's not going to be around the tech. It's going to be around how we structure ourselves and how we allow ourselves to work. So at the moment, we are very regulated and very central and we control decision making. And we can't exist like that anymore. We need to push as many decisions as close to the front line as possible. I think the biggest change around patient and citizen involvement will be directly involving patients and citizens in their own care a lot more and in the design of the services that are about them. I think that the ICSs have got a great opportunity to stitch these services up across local authority and health. We know that 90% of the problems that occur can be addressed by wider systemic social issues, not health issues. Healthcare will deal with about 10% of them. So it's going to be about how we operate, not what tools we use.
Wow, fantastic end answer. I'd like to say a massive thank you to you, James. You're a regular contributor to our events, and also it's been a pleasure to meet Delphine. It was a shame we didn't get to meet Kevin, who I'd actually got down on my notes as Keith, so maybe it's just as well, but I'm sorry Kevin didn't manage to get on the platform, but you two held us together beautifully with all your thoughts, so thank you very much indeed. You all both spoke so eloquently and knowledgeably on how technology can help the workforce and indeed patients. So we now are going to our final break of the day, and that means it's your last chance to get the most out of the event by taking advantage of all the functionalities on the NHE365 platform, whether you want to make a connection, share thoughts in the live chat, or chat with our exhibitors. I'll see you in a little over half an hour. We're rejoining the platform at 3:10, so see you then. Everybody, but they've gone.
Quick to go on there.
Okay.